Hi, everybody. Thanks for joining me for part two of this movement therapy series designed to maintain a healthy range of motion in our shoulder joints. So, in today's session, we are going to be looking at some really simple myofascial release techniques, that is, self massage, to help us alleviate tension and stress in the tissues and in the muscles around the joint itself. So we're going to be needing quite a handful of these props that I introduced in our welcome session. We're going to have two blocks, one of which I am sitting on right now. You're going to have a cushion or a bolster, maybe even a blanket off to the side. We're going to have that strap that we talked about at the beginning of our welcome session. And then we're going to have a tennis ball or therapy ball, and that might be part of your therapy ball setup already. But we're going to start with one, and then later on we will use them in a set of two. So let's go ahead and have a seat on a block. So you've got a little bit of height as something that lets your hip points come a little bit higher than your knees. It's a more easeful place for your spine to be as we take this therapy ball or tennis ball to the pectoralis major on the right side. So the pec major we can think about between the sternum and the head of your arm bone. This big muscle here is fair game. And we're going to take this tennis ball or a therapy ball and take a couple moments to bring a close to your eyes and roll the ball around the muscle. Let's get some circulation moving to this area of the body, right? Most of what we do with this shoulder joint entails this sort of reaching forward, whether we're riding a bike or driving a car, working on our computers, chopping vegetables, painting, playing piano. The list goes on and on and on. But typically we're reaching these arms forward. And when we have this forward reach of the arms, it tends to tighten this muscle that we are hydrating right now. So take a couple more moments, enjoy getting some circulation of that hyaluronic acid back into the tissues around the muscle. And then we can take this therapy ball or tennis ball over to the other side, right? Knowing that we have two, we're pretty symmetrical in our bodies, although we hold tension very asymmetrically. So you may notice that one side feels a little bit tighter than the other, and that might equate to your dominant side, right? Whether you're right-handed or left-handed. So take a couple more moments. Let's notice what's here with us. Maybe feel the muscle, feel the sensation around the muscle, right? Maybe feel the bone of the rib cage underneath the muscle. We might visualize the lung underneath the bone of the rib cage. So let's take just a few more moments here. And then we'll go ahead and pause. And if you'd like, you can stick that tennis ball or therapy ball back into its little sock or its little sack, tie your knot back up, and we're going to be using this here shortly. So from this point, let's go ahead and come off of the block that we are seated on. And we're going to take this block on its medium setting. I'm going to set it to the right side of your mat. And we'll lift this right arm and we're going to really kind of feel and palpate the lateral edge of your shoulder blade here. And once you've got a good sense of where that lateral edge of your shoulder blade is, we're going to set it down on the block. Now, if you have not done this before, this could be a little bit sensational. We're going to take a bend to the elbow. You're going to cradle your head. But as you come down, if you're finding that this is just a little too much sensation for you, throw your blanket over your block or maybe even wrap the mat over the block. So you've got a little more padding. And your left arm here is just going to be superfluous, so it can rest on your side body, or maybe it's on the floor to give you a little bit of support. And this is fascial release. So we're actually going to be here for a little bit. And I want you to take a little bit of awareness to your breath. And if we're holding the breath, let's see if all together we can do a nice big in-breath And a nice big out breath. Let's see if we can ask our bodies to become a little more amenable to the sensation that it's feeling right now. So we're really into this area of your upper trapezius. And when the upper trapezius is tight, it can inhibit our range of motion in the shoulder joint. So this is really going to give us some nice bandwidth, if you will, in the mobility of our shoulders. So let's take a moment to find a little sway side to side. This is very much what we call somatic movement. It's exploratory movement. If it doesn't feel good for you to find a little bit of this sort of fanning forward and back like I'm doing right now, pause in stillness and focus on your breath. We'll find just a few more moments here. And then from this place, we're going to use the support of our arms to bring ourselves all the way back up off of that block. And we'll move the block over to the left side to do our left side. So let's float this left arm up. And again, you're kind of feeling for the outer edge of the shoulder blade, the scapula back there. And then once you've got a good, keen sense of where you're going to be setting yourself down on the block, go ahead and start to transfer the weight over to this side. And again, like I was mentioning before, right, we're very symmetrical in the outsides of our physical organisms. But the way that we hold tension in the body is anything but symmetrical. So we might really notice when we're into places like this with really strong sensation that one side is considerably tighter than the other. So be with all of it. We always want to do both sides, even if one side is not feeling as tight as the other side. Breath is critical for us here. Remember that breath is very much a part of the range of motion that we have with our shoulders. So notice where the breath is right now. This is really going to open up space for your lungs. And our fascial system really takes cues from our breath. So if we're holding our breath, the body's going to tighten, it's going to contract, it's going to hold. And with fascial release or any sort of massage, self-massage technique, we're asking the body to release. So we really want to make sure that we are accessing breath here. And just like we did on the first side, if it feels interesting for you to do a little bit of fanning forward and back, a little bit of somatic exploration, right? That's an option that's available to you. But if it feels better just to pause, if this is the first time you've ever done something like this, it can be a little bit intense. So maybe we just want to pause and access our breath. And we're going to find just a few more moments here, right? With fascial release, we tend to spend a little bit of time. So here we go. Another breath or two. And then let's go ahead and pause. And we'll press through our hands and we'll start to bring ourselves all the way back up. And as we come back up into our upright position, go ahead and grab that block and let's just come to have a seat on our block again. So, right, anytime we let the hip points come higher than the knees, it's just a more easeful place for the spine when we're sitting this close to the floor. So something underneath you is very helpful here. And let's grab this strap that we brought along on the journey. Maybe we have a little bit of an echo here, right, underneath the armpits where we just had the block. And we're going to take this strap and we're going to hold it out in front. We're going to take the hands just a little bit wider than shoulder distance. And then from here, I want you to reach these arms forward, right? Think about bringing the head of the arm bone way out in front of the shoulder socket. And then with mindful awareness, right? Intention, pull the head of the arm bone back into the socket. It's a much more easeful place for us to move from. And we're going to start to bring these arms up. And I want you to give yourself permission to let your hands go as wide as they would like to go, keeping some tension on your strap. And as we take those arms up, we might do a little bit of side stretching, see what's here with us. Feels so good to get a little more stretch into these armpits. And then as we come back to center, you're going to give yourself permission again to let these arms go as wide as they need to start to open these arms back behind us. We might notice, right, just like I'm noticing right now as I'm looking in the camera, that one arm tends to drop a little bit quicker than the other. So again, these are movement patterns that sit in the body and show up in the body. So as we're pausing here, getting this really big stretch across the pectoralis major, that area where we had the tennis ball earlier, it might be nice to do just a little bit of turning of your head side to side. We've got a sweet little squeeze to the shoulder blades back there. You might even visualize those shoulder blades moving a little bit closer to the spine. All right, from here, let's bring the strap all the way back up, and you can bring it down in front. All right, we're going to take that strap. You can toss it off to the side, maybe give your shoulders a couple of rolls up and back. And then we could go the other direction, rolling forward and down. And then we're going to grab these therapy balls, and we're going to take them in between your shoulder blades with the spine running through the center, right? So notice that my therapy balls are not parallel. They're not perpendicular with my spine. My arm is my spine, but they are horizontal, right? So we're going to want to lay them on the floor. I am going to suggest that you have a blocker. Maybe now is a good time to have your cushion nearby as well. And we're going to lower ourselves down until we feel like these therapy balls are right between your shoulder blades, right? And once you've got yourself in the general vicinity, you can press through your feet, lift your hips, and kind of roll those balls up or roll the balls down. And the reason that we brought a block or cushion on the journey is that sometimes keeping pelvis to the floor and the upper back on the blocks can be intense, right? So we might want to press through the feet, lift the hips, slide a block on its low, flat setting underneath your pelvis. And that'll sort of offset the weight a little bit. So we start to find this massage, right? This deep tissue release for the muscles that we refer to as your rhomboids, these muscles that sit in between the shoulder blades. And those arms can come down along your side body. And then we're going to start to float these arms up towards the sky. And notice here that my wrists are really limp. They're like zombie arms. And I'm going to keep my elbows really limp. So I've got these really sort of passive arms here. And then we're going to play with bringing these arms up alongside the ears. That's going to get a little more intense. So move in a way that feels good for you, right? That feels nourishing for you. And then the arms come back up and the arms can come back down along your side body. And we can stay with this, kind of playing with our adventure here of releasing tension in the rhomboids right between the shoulder blades, right? Maybe we think about the back of the heart space, the back of the lungs. We're getting quite a bit of circulation of energy moving to this area of your body right now. And then I always like to invite you at this point to start to find a little more play with the arms, right? It's almost like you're conducting a phantom orchestra, right? Just move the arms around in, again, a little bit of this somatic play. So really moving through the range of motion in the shoulder joint and giving us a little more breathing space around the heart and lungs, around the shoulder blades back there. Okay, you can stay right where you are if you want to explore. You could roll the balls up just about an inch and then maybe adjust whatever it is that's underneath your pelvis and come back to finding your exploratory movement with your arms. So we're going to spend just about another minute and a half here. And at any time when it becomes less interesting, right, when we've kind of released the tension that might be being held here, you've always got the invitation to roll the balls down an inch, roll the balls up an inch, right? Just find a new place to kind of massage into. And again, if you've never done this before, I want to say welcome. Remember, I told you that these double therapy balls or tennis balls stuffed in a sock would quickly become your best friend. I'm hoping that you are really understanding that right now and perhaps agreeing with me. All right, we're going to take just another moment. So revisit any area of your body that you want to revisit back there. If you have something underneath your pelvis, like a block or a cushion, the first thing we're going to do is press through those feet, lift your hips, slide it out, pelvis comes down. We're going to gently roll to the right or the left, press through your hands, and bring yourself all the way back up. And again, before we come back down onto any other props, we might come back into our seated Sukhasana. Bring those fingertips to your shoulders like we did in the part one and find these baby bird wing elbow circles, right? Just kind of releasing, flushing, irrigating the tissues. All right, go ahead and pause. We are going to reach for these two blocks. We're going to use our blocks here. This is where we're going to close our practice. So let's take a couple of moments to really get these things set up. We're going to take the block on its medium setting again, but this time it's going to be running the length of the spine, and it's actually going to sit where we just had these therapy balls. And then you'll have a block on its tall setting, and notice that my blocks are not right next to each other. They're almost a hand distance away from each other. At this point, you are going to want to grab your blanket or your cushion or your bolster, whatever it is that you brought on your journey today. Have that close by. We're going to start to lower ourselves down onto our backs, and this block that's running long ways is really going to want to support the thoracic spine, which is the area of the rib cage. So we're back in between your shoulder blades. And then you're going to notice head goes to the tall block. You can adjust these. You're going to notice that this is a pretty big back bend. If we keep the hips all the way to the floor, and I know it's going to be too big of a back bend for many of us, so hang in there for just a moment. Have your feet in line with your sitting bones, and we're going to take a moment to press your feet into the floor, lift your hips, and kind of roll your body weight through that area between the shoulder blades. And then lower your hips back in the direction of the floor. They don't have to go all the way, but we'll go in that direction. And then you'll do that again. You'll press through the feet. You'll lift your hips. And then we'll slowly lower the pelvis back in the direction of the floor. Now, this next time that you lift your hips, let's reach for that blanket or that cushion or that bolster, and you can start to slide it underneath the pelvis. And then let your hips come down. And we'll notice that the body just sort of relaxes into this, right? We kind of release some of the intensity of the back bend. We've got some nice cushion underneath the pelvis. And this is the place we're going to hang out here for a little bit. So you're going to bring these arms along your side body, and we're going to have these palms facing each other. So your thumbs are pointing up towards the ceiling. And we'll start to bring these arms up towards the sky. And you're going to bring your arms along your cheeks, along your ears, and then you're going to let gravity come in and kind of pull those arms in a way that feels nourishing for you towards the floor. So we are on a lot of height, so your thumbs will probably not touch the floor, and that's not really our end game anyways. We just want to get a nice big tug through the tissues. And then bring the arms back down along your side body. All right, we're going to go again. So reach the arms up, right? Arms come alongside the ears. We feel gravity come in and start to give us that pull. And then bring the arms back down along your side body. All right. This time, as the arms come up towards the sky, let's just pause here. And you're going to bend your elbows and you're going to reach a hand for an elbow. And we'll take a moment to reach these elbows over towards the left and let your left hand pull on that right elbow. So give a little more stretch, like a manual stretch to the shoulder joint on the right. And then bring it back up to center. Let the elbows go over to the right. And this time, right hand gives a gentle pull on that left elbow, manually stretching. All right, let's go again. Bring it back up to center. And reach them over to the left. Bring them back up to center. And reach them over to the right. All right, from here, I'm going to meet you back at center. And we're going to take them back over to the left. And this time, sweep those forearms up towards your forehead. And then reach them over to the right, and then pull the forearms down towards your navel. So essentially, we're back to this circumferential range of motion in that shoulder joint, right? Drawing these circles. Maybe do one more in this direction, and then maybe as the arms come back up towards the forehead, change the direction of your circles. Move in a way that feels nourishing, that feels easeful, right? If we need to make smaller circles, we make smaller circles. All right, let's do one more. And then I'll meet you back kind of where we started. And from here, we're going to release these elbows and you're going to open these wings all the way out. And we're going to bend the elbows. So the elbows, the forearms, the backs of your hands come to rest on the floor, right? It's a little trick of the trade that when we get these elbows really supported, the nervous system starts to relax. So we're going to let ourselves settle in here, coming back to this idea of opening up the front of the heart space. And if we hearken back, right, to the last 20 or so minutes, we've really worked through the front of the heart, the back of the heart, the side of the heart, really accessing a little more range of motion in the shoulder joint, giving us better range of motion in our lungs, in our breath. And again, as we start to access that range of motion in the breath, we've got better access to our digestion, better access to nervous system regulation, and better sleep, better quality of life. Let's find a few more moments here. And of course, if this is a place that you love to be and you want to stay here for a few more moments, just reach over and press pause on the computer. If you are doing this as kind of a noonday release to that computer fatigue and you need to get back to your day, I'm going to start to transition us out of this place. So if you have something underneath your pelvis, let's walk these feet back in so your feet are in line with your sitting bones. And you'll press the feet, lift the hips, and we'll take whatever it is that's underneath the pelvis out. All right. Bring the arms close to the side body. Gently roll yourself to your right or your left. You're going to press through your hands to come up and come off of these blocks. And since we were just in a supported back bend, I want to take a moment to let your spine go the opposite direction. So once you've cleared your mat of your props, come down onto your back. Bring your knees in towards your chest, right? So after the extension in the spine, we honor a little bit of flexion. And you're going to wrap your arms around those legs, around your shins or your hamstrings, and give yourself a little bit of a hug, a little bit of a rock, maybe really feeling into the back, right? That shoulder girdle goes all the way from our collarbones to the head of the arm bone to the shoulder blades back there. Right, the entire shoulder girdle. So give yourself a little hug here, right? Knowing that we've been through all of these areas of the body. And then from here, go ahead and roll yourself over to the right or the left. Press through your hands to bring yourself all the way back up. I'll meet you back in this seated position. And thank you so much for joining me for part 2. I'd love to see you for part 3. A little bit of bone density, a little more heat, a little bit of strength building to tend to the strength of the bones in the shoulder joints. So, salud. Here's to our health.